Good evening, everyone, and I'm Mike Parson, the Governor of the State of Missouri, and I'm here to inform you that this afternoon Missouri tested the first case of COVID-19, a presumptive positive at the Missouri State Public Health Laboratory. The case is travel-related. The patient is a female in her 20s from St. Louis County who had recently traveled from Italy. She is isolated at home with family members who have also been in isolation. The patient went to St. Louis, Missouri area health providers with fever and respiratory challenges. The St. Louis County, Missouri Health Department arranged for testing for COVID-19. The Missouri State Public Health Laboratory has reported a presumptive positive result for COVID-19 and has forwarded to the Center of Disease Control and Prevention for confirmation. The Missouri Department of Health and Senior Services and the St. Louis County Health Department are investigating the situation further, and I am confident that they will continue to take all steps necessary to protect the health and safety of Missourians and Missouri communities. As of today, DHSS has tested a total of 26 individuals for COVID-19, including the presumptive positive case just announced. 3 additional tests remain in progress. As governor, I have no greater responsibility than to keep all Missourians healthy and safe. We have an excellent healthcare system, and I am extremely confident that Missouri is prepared to handle these cases as well as any others that may arise. We will continue to be proactive and ensure we are taking the necessary steps to educate, inform, and protect all Missourians. Again, I want to assure you that we will continue to work with the federal, the state, and local health officials and emergency personnel to keep Missouri safe and healthy. Now I'd like to turn it over to the County Executive, Sam Page.
Thank you, Governor. Thank you for being here tonight. I'm Sam Page. I'm the St. Louis County Executive. As a medical doctor, I understand how a novel coronavirus can impact our region. This is a serious challenge, and our public health officials are up to the task. Our public health system is resilient. Our region's top health experts are engaged, and everyone's working together to limit the spread and the impact of the coronavirus in our region as much as possible. We will work to contain this virus as much as possible. We are prepared. We are here to educate the public, and we are now responding to what is called a presumptive positive test result in St. Louis County. As you heard today, we learned that a young woman tested positive for a travel-associated novel coronavirus. This is not community acquired. The young woman and her parents are currently quarantined in her parents' home in St. Louis County, and the young woman had been studying abroad in Italy prior to arriving home earlier this week. She attends an out-of-state college. She called the Public Health Department's hotline, which is 314-615-2660, and received instructions which she followed. After coordinating with the health department, she was tested at a local hospital, Mercy Hospital, and you'll hear from them in a moment. The hospital staff followed all the proper procedures, making sure she was kept away from other patients, and all the healthcare personnel used the proper equipment to make sure that they would not come in contact with the virus. The student and her parents have assured us that they have not left her home since she became symptomatic a few days ago, except for the trip to the hospital to be tested. The parents are both asymptomatic, but they're being monitored at home and will be self-quarantined. We will continue to monitor this situation very closely. As a parent, I can only imagine what her parents and other parents are thinking as we work through this. As a doctor, I've seen similar patients in similar situations and counseled them and their parents. I understand these challenges. The St. Louis County Public Health Department has already notified the Unified Health Command so that all area health directors understand what we're doing and are up to date. They will now conduct, our health department will now conduct an epidemiological workup so that everyone the student may have encountered or may have been contacted by her since she arrived can be investigated. We'll contact everyone she may have encountered to see if they were symptomatic and encourage further testing if it's appropriate. The role of the health department, as we've said before, the St. Louis County Health Department, is to prepare. That means we monitor the status of the outbreak, and that means the progress around the globe and in our region. We will coordinate with state, federal, and regional governments and with healthcare institutions and our local experts. We will plan. That means we identify state-of-the-art strategies and evaluate options. We will evaluate. We will regularly educate and provide accurate and reliable information to the public through our website, through the media, and our website is stlcorona.com. The county's coronavirus hotline, as we said before, is 314-615-2660, and that's monitored 24/7. We will respond. That means we'll mobilize strategically, activate our resources whenever they're needed. We will collaborate and work with our regional partners, and we will deliver any resources necessary quickly and evaluate people who need them. Remember, prevention is the key. This coronavirus may be new, but the ways to prevent it are tried and true and well established. We need to understand a couple of things. The reality is that there are constraints around testing for this virus. The United States is not a point where we can provide testing to the general public. The testing is currently reserved to people who are symptomatic. It is not useful on people who are not symptomatic. We also know that these viruses are easily transmitted, and that means, as we've been saying consistently, wash your hands with soap and water, use a hand sanitizer when they're not available. If you're sick, avoid other people, avoid people who are sick, and use the same precautions that you use for anyone who had flu symptoms, and keep things in perspective. We will again emphasize that this is not a time to panic. Thank you. Dr. Sengupta, you want to talk about Mercy?
Thank you, Sam. Hi, my name is Dr. Alok Sengupta. I'm the chairman of the emergency department at Mercy Hospital St. Louis. Mercy Health as a ministry has been preparing for COVID-19 for several months now. We have had task force and subgroups planning all aspects of this disease. Along with that, each of our hospitals have had infection control teams that have been working with the health department closely to prepare for this. Yesterday morning, the health department notified Mercy Hospital St. Louis that there was a patient that needed to be tested for COVID-19. That patient was brought to the Mercy Hospital St. Louis Emergency Department and was brought straight to one of our negative pressure rooms. Our staff, physicians, nurses, everyone who has encountered the patient used personal protective equipment from start to finish. The patient was tested. The patient did not meet any of our admission criteria. At that point, we talked with our infection control teams, who then talked with the health department, and we discharged the patient home. We'd really like to thank the health department for their support through this, and I'm really proud of our group who followed all recommendations perfectly. So.
I would also like to I'm grateful Congressman Wagner's here tonight, that she was in town. She's going to join us for this and to give you a little update on the federal level of what they're doing and how they're supporting the states and the local government. So, Ann.
Thank you, Governor. I appreciate it very, very much. I'm Ann Wagner. I represent Missouri's 2nd Congressional District. I want to thank the Governor and our county executive for their tremendous leadership, Mercy Hospital and the other healthcare professionals that are here with us today. We have had multiple briefings at the federal level for some time. I serve on the Foreign Affairs Committee. I spoke with the Vice President at a briefing as recent as this past Thursday, along with the CDC and our Food and Drug Administration. I'm grateful for the to learn that testing is going to be accessible at the state and local academic level, providing more direct testing for patients without a bureaucratic mess going through the federal government. I just got off of the phone with a Dr. Stephen Hahn of the Food and Drug Administration. He's the commissioner, and he assured me that as of close of business yesterday, 1.1 million tests had gone out to the states, that an additional 1 million will be going out as of close of business on Monday, and that an additional 4 million tests will be out by the end of next week. As I said, this is it's clear that I think the risk to our U.S. public is low. We must follow the protocols and remain vigilant. This week, Congress passed a $7.8 billion emergency funding package for workers and government officials to respond to the spread of the coronavirus. This was done in a nearly unanimous and bipartisan manner. I can tell you that that $4 billion is going to go for diagnostic tests, and there's also going to be an investment in procurement of a vaccine, and to protect our medical supply chain and to treat the coronavirus patients. It will also include the CDC receiving $2.2 billion to support our state and local officials here. And obviously, the CDC webpage is another good place to go to find protocols and information regarding this. I want to thank all of the leadership here. It is our number one priority at the local, at the state, and certainly at the federal level to ensure the safety and the security of our citizens here in St. Louis County, in the 2nd District, in the state of Missouri, and across our country. So I thank you for the opportunity to give you a briefing from the federal level, and I will toss it back to the governor. Thank you.
I think at this time we're going to open it up for a few questions here, so if you want to ask questions.
Governor, a question for you or the doctor from Mercy. How safe is it for the general public to go into Mercy Hospital right now?
From my opinion, I would tell you, I think it's absolutely safe. I think everything we had prepared for here in the state, from all the way from the federal, the state, the local levels, and when this case did occur, it worked like it was supposed to work. Everybody did their jobs, and I think without a doubt, you see we were prepared for that, and it's the outcome of the day. The patients, I believe, will be safe. I believe the medical facility that treated did everything that they did, but I will let the doctor kind of explain to you that process of what happened at the hospital. Doctor?
Certainly. Thank you. So there are set guidelines from the CDC and the health department that we have followed completely. That patient, like I said, was brought in immediately to a negative pressure room, was there for the duration and discharged. After the patient left, the rooms are cleaned to the standards that the CDC and the health department set, and we have no concerns about patients being at risk at our hospital.
Thanks, sir.
Doctor, how quickly have you been able to locate and identify contacts of this person?
That'd be a question for the.
Where our health department's in the process of interviewing the involved the individual that was tested positive, and have implemented all the appropriate studies and epidemiologic questioning, and they'll move through that over the next couple of days. But it will take some time to track everyone that might have been encountered and work with transportation and other agencies to make sure that they're identified, and that does take some time.
Where does this 20-year-old want to live?
St. Louis County.
Where in the county?
We're not going to release that information for, we will imagine that over time there will be other folks involved, but they're in their home in St. Louis County and they're sequestered from everyone else and they're quarantined, and that is the guidelines that we're following across the country.
Do you know if she was returning home from school work?
She was returning home from travel abroad in Italy.
Can you confirm what part of Italy?
I don't know what part of Italy.
Dr. Page, how about when the website will be updated? Because I know county and governor, Missouri has a website too. I just checked the website, not updated yet. So will it be updated daily or quarterly? I mean, 15 minutes updated.
Which website do you mean?
The St. Louis County, St. Louis Corona website for this case.
So the St. Louis Corona website is, it has live links to the CDC and other agencies, and those agencies are updated. I'm sure once we have a presumptive positive case right now, those are updated on a pretty regular basis. And then when it's confirmed, we won't be able to confirm it through the CDC until sometime in the middle of next week.
How long does it take to confirm a straight positive result from a presumptive positive?
On average, 5 days for confirmation. Tests usually take, the initial test is 24 to 48 hours. This test was returned in 24 hours.
I have a question for doctor. Dr. Page just said parents and patient will know the feeling, but why she be discharged from the hospital if she is positive, and how you control if the patient leave the hospital, go home? Can you control the patient doesn't walk around or go shopping or something like that?
So I think that's more
Sure.
questions.
Well,
Sorry.
we depend on people to do the right thing. We ask them to self-quarantine. We're not going to escort them home. But what we found is that everyone is very cooperative. Everyone understands the risk that they put others to. This patient was not sick enough to stay in the hospital, did not need intensive medical care, and it's appropriate and better for them to be at home than be in a hospital around other people or to be around other patients who might be ill.
That'll be 14 days for her?
Her quarantine will last at least 14 days after she no longer has symptoms.
Are there people that are on a flight that may be watching this that should have concern if they were on a flight from Italy or maybe encountered this person?
I think everyone should watch the CDC webpage for information which is updated on a regular basis about travel restrictions, which countries are involved, and what the concerns are with individual countries. But that depends on the individual country involved.
Now, speaking of everyone, talk about the healthcare workers. Which hospital, which Mercy was it, doctor?
This is Mercy Hospital, St. Louis.
And what's being done with the healthcare workers who were around her?
Absolutely. So, like you mentioned, our healthcare workers responded just the way we would want. They had protective personal equipment on from the moment the patient walked in till the patient walked out, which puts them at extremely low risk. Once again, we're following the CDC and Health Department guidelines of monitoring them daily, but they are at extremely low risk since they followed the PPE recommendations.
And can you elaborate on something you said earlier? It did not meet your protocol to admit them. Well, a lot of people don't know what that means if they didn't go to medical school. Can you break that down, what that means?
Absolutely. So obviously, patients we admit to hospitals are patients that we have some treatment to provide to them. So if they need, for example, IV antibiotics or supplemental oxygen or things like that that we can provide in a hospital setting, those are the patients we want to admit to the hospital to treat. If a patient's symptoms are not that severe and they don't need those things, they're better off being quarantined at home. Obviously, in a hospital setting, we have patients who have comorbid situations, and we don't want to have them exposed to other viral illnesses, including COVID-19, if there isn't a medical necessity.
And one more thing on your medical expertise, doctor. Even I'm gonna have to research this. We're telling people every day, do not panic, but we're using words presumptive, positive, normal, COVID. What does all that really mean? Is this just positive, we're waiting on the official result? Or
Correct.
Is this, it might not be anything?
Now,
I think we have to be very careful with vocabulary. This is a test that is not FDA approved, and we have to be careful about the words we use and be specific about them. The medical community and scientific community is quite obsessed with vocabulary and being specific for several reasons. But this, we don't expect, historically, someone with symptoms, someone who had a positive test, we would, it's highly likely that it comes back confirmed. The test that's performed by the CDC is the exact same test that's performed here. So it is unlikely that it will change. But because it's not an FDA-approved test, the language we will use is presumptive positive, although there is no expectation that it would change. It is within the realm of possibility and scientific inquiry, but that's the vocabulary of the medical community.
Okay, we're going to take one more question, sir.
So Sam, just reiterating the points from the very beginning, what are you telling the St. Louis County public as they watch this come out? And again, first presumptive positive case, what are you telling people? What's the bottom line?
Well, I think the theme here is that this is a travel related case. This was acquired in another country. This person returned home, followed all the proper procedures for the quarantine, And when they became symptomatic, they were tested in a local facility. Everyone in that local facility followed all the proper precautions. The person was sent away because they weren't sick enough to require hospitalization, and they're at home now, and that everyone who took care of that patient followed all the proper procedures. And they are safe, and that institution is safe. And we will move forward, and we will see if we have other travel-related cases that pop up. It's possible. We're seeing that around the country. If they do, we'll react appropriately, and we'll try and do the proper public health response, which is to track their contacts and watch their contacts and give them the proper treatment as well.
Okay, thank you very
Good
much.
job. Good job.
Thank you.
Governor,